mynews.studio.
So, under the shadow of a decade-old crisis, the world managed to sharply reduce HIV transmission from mothers to newborns. How did that actually happen?
Today is 2025/7/19. If we look back 10 years, there were more than 310,000 young children newly infected with HIV every year. Most of those cases happened because the virus was passed from mothers to their babies, during pregnancy, at birth, or through breastfeeding. In places like sub-Saharan Africa, if there was no intervention, the risk ranged from 15% to 45%. Why was stopping transmission so difficult back then?
Access was the main problem. Many countries simply didn't have the resources for widespread prevention. In high-burden regions with limited health care and where breastfeeding is common, prevention just wasn't realistic for most families.
But things shifted. The global rollout of anti-retroviral therapy, ART, began to change the picture. By 2024, 84% of pregnant women with HIV were on ART. That's a big jump. Was that the main reason we saw such a dramatic drop in new cases among children?
It was a mix of things. ART access was critical, but global coordination through initiatives like the Global Plan towards the elimination of new HIV infections among children, which started in 2011, made a big difference. The numbers tell the story. By 2024, new pediatric infections fell to about 120,000, a 62% drop since 2010. In the UK and France, the risk is now down to around 0.2 to 0.3%. Even some areas in sub-Saharan Africa are reporting rates below 5% when treatment is widely available.
That's a huge shift. But what were the specific interventions that made this possible?
There were 4 big factors. First, expanded ART, lifelong treatment for pregnant and breastfeeding women living with HIV. Second, HIV prevention became part of routine maternal and child health services. Third, using real-time data helped target interventions where they were needed most. And fourth, international funding, like PEPFAR and the Triple Elimination Initiative, allowed these proven strategies to reach scale.
And on the ground, community interventions, local partnerships, how much impact did those actually have?
They were essential. Integrating HIV services with maternal and child health meant women got continuous support, which is crucial for staying on ART. Community health workers, peer support, local NGOs, they all helped overcome barriers like getting to clinics and dealing with stigma. In Uganda, for example, when services were integrated and supported by both PEPFAR and local health workers, transmission rates dropped from 30% to 3% over 20 years.
So it's clearly not just about the medicine, it's about building trust and local engagement too. Did these approaches also help women get tested and treated earlier?
Absolutely. Early testing, education that fits the culture, and support groups all made a real difference. When women trust the system, they're more likely to stay in care and stick with treatment.
Diagnostics, early infant testing. These played a role too, right? How did that change things?
Point-of-care testing and better diagnostics meant infants could be tested just weeks after birth, not months or even years later. The sooner the diagnosis, the sooner ART can start. That's vital, not only for survival, but to keep the virus from progressing. Early intervention gives both infants and mothers much better outcomes.
But we're not finished, are we? What's standing in the way of completely eliminating mother-to-child transmission?
Progress has slowed. Some regions are still far behind, especially where resources are low. Stigma and cultural beliefs remain stubborn barriers. Some women fear discrimination or even violence, which keeps them from seeking care or staying on treatment. And in some places, cultural norms make it hard for women to make decisions about their health.
So how do we actually tackle these persistent barriers?
Education that respects local culture is key. You need community engagement to reduce stigma and peer networks to empower women. The goal is to make HIV treatment ordinary, just another part of routine healthcare.
And why should the whole world care about this story, not just the countries most affected?
It's an example of what's possible when there's international cooperation and medical innovation. Fewer children with HIV means healthier families, less stigma, and economic relief for communities. It's a roadmap for how the world can tackle other diseases together.
So today, we've looked at how global teamwork, medical advances, community action, and better diagnostics have all helped drive down pediatric HIV rates. But the fight isn't over, especially with stigma and care gaps still in the way.
Thanks for joining us as we explored the effort to reduce mother-to-child HIV transmission. The progress is real, but there's more to do.
Thank you for listening. This episode was powered by mynews.studio. Try it now for free.